Hayden Panettiere had been very vocal about her struggles with addiction and postpartum depression. Her death is sparking conversations about dealing with mental health issues and recovering from hard times.
That's right. Dr. Lantie Jorandby is a board-certified psychiatrist, and she's here to talk about the battles that many people deal with and work to overcome. Thank you so much for being with us this morning, Doctor.
Thank you for having me.
Yeah, of course, this case is drawing attention because she was a high-profile person. She was forthcoming about her addiction and her pain. She actually wrote in a memoir and was very open about all of this. I think that gives people a sense that someone is in a good place if they write about something. Talk about how that can sometimes be misleading.
I think Hayden really did a great job with just being very open about her struggles. I think that helps normalize some of what people go through. In a sense, there's not as much stigma. So when you think about all the mental health struggles people are having, a lot of times there's a lot of shame or guilt around what they're dealing with. So Hayden really opened that up. And being so open about her own problems, she's a very well-known actress, beautiful, talented, but she still had struggles. It really, I think, makes care more accessible. People want to get help. They're going to be less stigmatized to look for help or go and get treatment. So I think it really was a good thing that she did for just the community, for mental health at large.
I absolutely agree with you. I also think, when you look at her life, she had such compounding trauma. You talk about postpartum depression, losing custody of her daughter. Her brother died in 2023. How does that show, or how can we look at that? Somebody's able to state the pain that they're in, but they can still be in pain, right?
Exactly. And I think especially with losing her brother, just dealing with all of the things, the trauma of postpartum depression, I know she was struggling with. She was open, she was talking about it, but it's almost a therapeutic process for people when they do write about it or they share it, because they're looking to finish their story to really make it meaningful. And the sharing that they're doing helps other people. So I think it's a very therapeutic process, but it doesn't mean it's over.
Right.
And I think when you look at addiction, you look at depression and mental health, it's often a lifelong struggle. It's a lifelong journey to recovery.
Absolutely. And being on the forefront of kind of erasing that stigma, we kind of saw with her speaking out about postpartum depression, going through her branding deal with Neutrogena, in part people saying being ruined by her speaking out and being honest about postpartum depression. We also see the Lindsay Clancy trial that a lot of people are watching right now and talking about postpartum depression. And it's still such a misunderstood issue for a lot of people.
Absolutely. And watching both the Lindsay Clancy trial and knowing Hayden had struggled as well, it's frustrating because I think it's so under-recognized, it's underdiagnosed.
Right.
I actually started my career in OBGYN, and so I know the peripartum and postpartum period for women can be tremendously stressful. You've got a new baby, you're not sleeping, you may have hormone fluctuations that were unexpected, there may be medical complications, previous depression. So all of those things factor in. And I think OBGYNs and psychiatrists really, there's not a lot of awareness, even in the medical field, around postpartum depression and mental health. And in fact, Lindsay Clancy had just been discharged from one of the best psychiatric hospitals in the country a couple of weeks before she took her children's lives. So there really needs to be more awareness, a better approach to diagnosis and treatment in that area.
I also think, like you're talking about, I think sometimes there can be a team of people around, but they're not all talking to each other, right? So it's almost getting everybody on the same page here. I also know postpartum and addiction can kind of like work together with one another and exasperate one another, because usually when you are an addict, you're trying to numb pain. You have a baby, you're in postpartum, you're now trying to numb that new pain. Can you just talk about how this can become a vicious cycle?
Right. So postpartum is a mental health disorder, postpartum depression. And so mental health and addiction often go hand in hand. Unfortunately, when people have trauma or they've been through something that triggers an anxiety disorder or depression, often substances can help them feel better. And if that is becoming a compulsive behavior or it takes off, then you have both a mental health problem and an addiction problem. And so they do compound each other. And people in that person's life need to be aware that these folks may be struggling. They need to be mindful that they may need treatment. They may need help to get treatment. Often people are afraid to ask for help. So if someone is a loved one in that person's life is seeing them struggle, really being open to them, making sure that they have the supports they need, getting them help, getting them to a doctor, getting them to a treatment program is going to be so key. So where I work currently, that's what we do. We address both the mental health and the addictive aspects, because if you don't address one, the other won't get better. So they're just hand in hand.
Absolutely. Well, Dr. Jorandby, thank you so much for joining us this morning on this very important issue.
Thank you for having me. Thank you.